series of webinars regarding COVID-19. Today's webinar is Keeping Patients, Practices, and Ourselves Healthy, Challenges and Opportunities in Pediatrics During COVID-19 and Beyond. Next slide, please. I want to welcome you. I'm Kristen Flewitt, the Senior Quality Manager at the Ohio chapter of the American Academy of Pediatrics, and we want to thank you for joining us today. We've been thinking and planning ways to support Ohio's pediatric providers more than ever in the recent weeks and want to do all we can to support you during this challenging time. We hope our webinar series will help provide you with support and resources. Never hesitate to reach out to us with additional needs. A few housekeeping items. In an effort to control background noise, we will be muting participants during the webinar. You will be able to chat in comments and questions in the chat box, and our panelists and staff will be chatting in answers. We would also love you to share your experiences and strategies for remobilizing clinical services, supporting families, and provider wellness. We will be saving and sharing a chat transcript following the webinar, and we will also share all of today's slides and a recording of the webinar. Let me review with you how to chat your comments in. If you notice on the slide, if you hover at the top or sometimes the bottom of your screen, you'll see a little bubble, which the red arrow is pointing at. If you click on that, it should bring up a column where you'll be able to text in your comments or questions, and you can select whether to send those to everyone or an individual person. Next slide, please. And just a little reminder, we're very excited to be able to provide these webcasts to our members. If you've not had a chance to join the chapter or would like to rejoin, we will be sending information after the call for you to renew your membership or join the chapter. Next slide. Our objectives today are to increase knowledge regarding strategies to engage patients in care during COVID-19, also increase knowledge of self-care strategies, and increase knowledge and ways to support families during the pandemic. Next slide. Our panelists today, I'd like to introduce them briefly. We will be sending out a complete bio, but to save time, we wanted to just do a brief introduction. Dr. Michelle Dritz is an adolescent medicine physician at Cornerstone Pediatrics in the Dayton area. She is also a delegate at large on the board at the Ohio AAP. Dr. Chris Peltier is a pediatrician at Pediatric Associates of Mount Carmel in the Cincinnati area. He is the president-elect of the board at the Ohio AAP. And finally, Dr. Denise Warwick is a pediatrician at Group Health Anderson in the Cincinnati area. She is a delegate at large on the board at the Ohio AAP, and I want to thank all of our panelists today for providing this great webinar. Next slide, and I will turn it over to Dr. Peltier.
Thanks, Kristen. So I have to apologize. My computer just froze up and died. So I'm back on. Hopefully I'll be able to stay with you for the rest of the presentation. As Kristen said, my name is Chris Peltier. I'm a general pediatrician in a 9-doctor, 3-office location practice in suburban Cincinnati. And wanted to sort of talk a little bit about clinical remobilization during this COVID-19 pandemic. And we're going to highlight some of the things that we presented on our last webinar, as well as some new data. Next slide, please. So I'm going to look at this in sort of 2 different sort of areas. First, I want to look a little bit at practice health, looking at finances, patient volume, and then we're going to look at sort of patient care and how the pandemic and the quarantine shelter at home has affected or could affect the health of our patients. So this is some data from PCC, which is Physicians Computer Company, which is our EHR vendor. They're located in Burlington, Vermont. And this is a snapshot of their total visits of all of their pediatricians across the country. So this is national data from PCC. And you can see this graph looks at percent of norm of total visits as well as total charges, really beginning in the 2nd week of March and going through near the end of April. And no surprise, as I'm sure you all are seeing in your practices, we see not only a decrease in sick visits and well visits, but also total charges. Now, luckily, near the end of April, you start to see a little bit of an uptick. And that's really what we want to focus on, is where we're at now in mid-May and how we can sort of continue to help your practices and your clinics increase those total visits, as well as hopefully your charges and payments. Next slide. This is just another representation of average weekly charges and average weekly payments. And you see in that second week of March, just that deep dive that many of us, most of us in fact, saw during practice, and took really 6 to almost 8 weeks for that to begin to dip back up, but still nowhere near where those average weekly charges had been prior to COVID-19 in early January. This has really caused a lot of struggle for lots of independent practices, especially those that were not able to get the PPP loan or other funding from the government. Next slide, please. This is just some local data. This is actually from our EHR dashboard that looks at our weekly sick and well visits. And again, overall total visits are down. But what I want you to look at and really notice is that despite visits being down overall, you start to see as we get into mid-April and early May, we see an increase in our well visits. Sick visits are down. They're going to be down. People have been sheltered in place, which is good to decrease exposure to COVID-19, but it also means we're going to see less illness, and that's probably going to continue for a while. My managing partner likes to say we can't control the ill visits that come into our office. But what we can do, and what we really are going to focus on over the next few minutes in this webinar, is really how we can increase well visits and why we should be doing that, not only for the health of our patients, but the health of our practice.
All that in.
Next slide, please. So this is a graph that shows charges and payments for our practice as compared to sort of the national average of PCC clients. And the reason I want to show that is that because of some of the things that we're going to talk about and some of the things that we were able to implement early on in our practice, doing recalls, beefing up our website messaging, beefing up our social media messaging, that we've been able to increase our charges and as a result, our payments from our payers compared to other practices across the country. So hopefully, I wanted to show you this data to show you that the things that we're going to present are things that my practice did and that really helped our practice out. Next slide, please. 2 weeks ago, we had a great webinar on telehealth, and we're not going to talk a lot about telehealth, but I just wanted to briefly do a couple follow-up slides. We are seeing obviously more providers ramping up and doing telehealth. And now with the state beginning to open up, families now have the option to decide whether to see patients in the office or, if appropriate, virtually via telehealth. We really need to balance families' potential fear of or inconvenience of coming back into the office versus how the provider would like to see that patient, and obviously dealing with the decreased physical exam that we can do via telehealth. And then, of course, as was mentioned last week, this is a great modality for doing behavioral health follow-ups via telehealth. Next slide, please. So this is just a breakdown of nationally PCC clients, and you can see that really up until about mid-March, very few practices in PCC that use PCC EHR were doing telehealth. And you can really see how that's ramped up compared to the beginning of the year. Next slide. And this is our own practice data. And you can see we, as a practice, although we're doing telehealth, and in late March, we were sort of doing telehealth at about the same average as other practices that use PCC. But as you can see, going into April and May, our volume of telehealth has definitely decreased. And we really are sort of trying to look at that. We're not sure exactly why that is. And hopefully we're thinking, I'd like to think that some of the things that we're going to talk about, some of the messaging and some of the practice changes that we've implemented have made our families more comfortable to coming in, and that hopefully that's why we're seeing a decrease in telehealth visits. Next slide, please. And this is a really key piece of data. This is, again, national PCC client data that looks at payments received for in-person visits in the blue versus telemed visits in the red. And you can see, again, this is national data, but you can see they're very comparable, especially when you're looking at 99213s and 99214s. They're just a couple of dollars different. So all of the different state AAP chapters, including here in Ohio, all of that advocacy with state government to sort of it really focus on and argue and advocate for parity in in-person and telehealth visits is really paid off. So my message to you would be, if you're seeing that you are not being paid near the same rate for telehealth visits as you are in person, you really need to reach out for your payers because you should be seeing that same amount of payment. Next slide, please. So that's a little bit about sort of the landscape over the last 8 weeks, sort of the damage that it's done to some of the practices' financial status, and why it's important to get patients back into our office from a practice health. Let's focus a little bit on why it's important, obviously, to get kids back into our office from a child health standpoint. This is some data from the CDC, and I put the link to MMWR up at the top of the slide. This is looking at really the beginning of 2020 through mid-April, and you can see that really beginning in mid-March, when the U.S. national emergency was declared by the federal government, a drop in doses of non-influenza vaccines, and then sort of mirroring that, measles containing doses. So we see sort of that second half of March into April, a huge drop in doses of vaccines being given to our children. Next slide, please. And then this graph, this bar graph really focuses on measles containing vaccines, both for kids under the age of 2, as well as for that second booster dose, typically at age 4 to 6. And you can just see that rapid decrease. And, over the last few years, as most of you know, there's been increases in measles in this country. And I really am worried about sort of patients not coming in, getting their vaccines, and that not only are we going to be dealing with COVID in the fall, influenza in the fall, but potentially crops of outbreaks of measles. That's why it's vital to get our kids back into the office to get them immunized. Next slide, please. And then this is just, again, another graph looking at PCC, EHR users, and their decrease in vaccination usage. Now, the good news is that you start seeing in mid-April an upswing. And so hopefully that will continue, and you will be able to use some of the things that we're presenting to you today to make your patients feel comfortable and actively getting them back into their office to bring those immunization rates back up. Next slide, please. So looking at well care visits in your office, as was mentioned at the teleconference, at the webinar 2 weeks ago, and there's been no change, there is no current payment in Ohio for well child care via telehealth. As you all know, office-based well care not only is essential for physical examination, but also screenings, vision, hearing, maternal depression, lead screening, depression screening, and then, as we mentioned, immunizations. Next slide, please. Thinking about acute care and how can we safely get ill kids back into our visits, again, telehealth can be used, especially for those kids that you may be suspicious that might have COVID-19 and that you don't want to bring into your office. Some of the things that many practices have done are having, if you have more than one office, having a separate office for well care and ill care. We have 3 offices in our practice. 2 of them are for well visits only. In our main office, we do separate well appointments in the morning and then ill care in the afternoon. And not only having a plan or a protocol for cleaning rooms after each visit, but publicizing that. We're going to talk a little bit about letting your patients know exactly what you're doing to keep your office and your family safe. And then obviously, if you're doing well visits and ill visits in the same office, having separate sides of your office, separate rooms for both well care and ill care. Next slide, please. We need to be ready for what we're calling the catch-up care, right? So as Ohio loosens the stay-at-home, shelter-at-home, and we move into more Stay Safe Ohio, we are going to need to think about how are we going to staff, how are we going to have capability in our offices to see those kids and catch them up for well visits, sports physicals, and importantly, immunizations that weren't coming in during March, April, and May because of the quarantine. So some things that many practices have done are having vaccine-only clinics for well patients, maybe on a Saturday morning, doing a drive-by vaccine clinic, meeting your families out in the parking lot and doing vaccines sort of in a drive-by clinic, administering vaccine during acute care visits. So if a child comes in for an ill visit and you notice that they're behind on their vaccines, taking that opportunity to vaccinate them. Same thing if you notice that they're due for a well visit and they come in for an ill visit. Our schedules are a little bit slower now. It's a perfect opportunity to convert that ill visit to a well visit and bill for both visits using a 25 modifier. And then considering evening or weekend well visit sessions that we normally might not have office hours, we need to be available for our patients, not only for the financial health of our practices, but also for the health of our children in our practices. Next slide, please. Just going over a little bit of some patient and family survey. This was a national survey that was done in late April, where one of the things that they asked were if, and this is both adult as well as pediatrics, but if you have a medical issue that would require surgery or treatment when the pandemic fades, 41% of the respondents of the 600 people that did the survey were extremely concerned about an outpatient visit in the next couple of months. Next slide, please. When asked what would make them feel more comfortable and reassure them that it was safe to come to an outpatient office, cleanliness of the facility was right up there with excellent clinical quality, right? Not something we normally think about. We think about what makes our practice attractive. Normally, we would think of excellent clinical quality, but cleanliness of the facility was right up there, as was protocols to protect patients from infection. And then, as we mentioned, having a separate facility for patients that were COVID-19 positive. Next slide, please. Looking at how the survey also looked at how did families want to be have communication with their practice, and the majority, 62%, said their number one option was by email, and then second, of course, was telephone. But other things that you may not be doing right now are 20% wanted to do website and 15% social media. If your practice does not have a website, the first thing you need to do after this webinar is get a website designed. There are lots of different options, lots of different companies that can help you do that, but you need to have a website. The second thing you need to do is if your practice does not have a Facebook or a Twitter account, you need to do that. You need to, this is how families get information nowadays, and you need to be on social media, presenting information, not only medical information, but also about your practice. Cincinnati Children's reached out to families that patients of theirs that have complex care, and found that during the COVID epidemic, only 7% of families that they contacted with children with complex medical issues actually contacted their pediatrician. We need to reach out to our families now more than ever, again, for the health of our practices as well as the health of the children. Next slide, please. So these are just some of the key messages that are available. We're going to be sharing these later this week in a toolkit that we're going to mention. But just some, I think the biggest thing, whether it's your staff or it's you as a provider, you need to offer empathy to the families, that you realize that this has been a hard time for many people for many different reasons. Talking about providing next steps, letting them know that you're open, that what are the expectations for that visit? Talking about some of the cleaning regimens that you've implemented, the PPE that we are all wearing, how every day your office staff and the physicians are screened for illness by taking their temperature. Next slide, please. And again, providing those clear guidelines to the families so that you know what you want them to do. Encouraging limited number of family members, one parent, one child to your office. encouraging them to wear masks, or your practice may decide that you're going to require families to have masks. If you're going to do that, make sure that you have enough supply to provide those with your families. And then giving them a way for feedback, letting them know, having a patient satisfaction form or an email address so that they can give you feedback on how you're doing, how we're doing, in helping them feel comfortable and safe. Next slide, please. So this is sort of, I think, my take-home slide, right? So getting patients back into your office. Many of us are slower. We're not seeing as many patients. Make use of your staff. Make the most of this downtime. Generate recall lists. Who is due or overdue for their annual well visits, for vaccine immunization visits, for your chronic care kids, asthmatics, kids that are obese, behavioral, ADHD, depression, anxiety, acne, any sort of chronic care follow-up. This is the chance. We have the time. Not only is it going to help your practice, the health of your practice, but it's just good care for our patients. Utilizing reports for outreach. Contact your EHR support people to sort of figure out how are you going to run reports. Prioritize. Maybe it's you want to start with kids 2 and under to make sure that you have all of your kids get their primary vaccines. Then you may move to focus on 4 to 6-year-olds for kindergarten checkups, focusing on 11 to 12-year-olds for those 11-year Atacel, HPV, Menactra vaccines. Using materials from the chapter as well as ODH to market to your families that the governor, Dr. Acton, are telling us it's safe to go to your pediatrician. You should be going to your pediatrician. Many EHRs, I know Epic is using this. Dr. Warwick is using this in her practice through Epic. Our EHR has recently rolled out, allowing us to do emails and texting to our families, giving them updates that we're open. These are some of the things that we're doing. And then social media marketing. Have a separate tab on your website devoted to COVID-19, documenting what new procedures you're doing for cleaning, what PPE equipment you're doing to keep them and your children safe. Do a Facebook Live post that shows your staff cleaning the offices between rooms. These are all things that you can do to, number one, let your patients know that you're there for them and that it's safe to come back to your offices. Next slide, please. Just a couple of challenges that practices are going to be facing. This is from the National Federation of High School Sports, and their recommendations nationally are that parents and guardians should be informed that extending the duration between PPEs is a deviation from standard of care. But given the already existing variation among states where there isn't evidence to the contrary, they believe that a change in practice and allowing an extension for the next academic year for pre-participation forms should be granted. And many states have adopted this. So many states have already said your sports form from last school year will count for you for this school year. That is just, in my opinion, is just not good care for children. In Ohio, that decision has not been made yet, and the chapter has been advocating to the OHSAA that why we feel it's important to see our kids every year for sports physicals. So stay tuned. Next slide, please. The other challenge that we're going to see is that we are going to see an increase in families losing their health insurance because of the economic ramifications of this pandemic. We are going to see an increase in patients needing to go on Medicaid. So practices need to be ready to, if you are taking Medicaid already, to keep your patients that may have to transition and helping them transition to Medicaid. And if you're not taking Medicaid patients, now is the time to think about beginning that practice, because you will have families that lose their insurance and that that will need to be on Medicaid, a managed Medicaid plan. So we, again, need to be there for those families. Now is not the time to let those families fall out of our practice. Next slide, please. Just going to end my portion with a couple of places that you can go for resources. This is the Practice Management Institute COVID-19 Business Impact Forum. Many of you are probably aware of Paul Van Schier's and Chip Hart's weekly Thursday night webinars. And this is what's grown from that. So if you go to forum.pediatric pediatriciansupport.com. There are over 3,000 pediatricians across the country that are posting challenges, opportunities, solutions. This is a free site. You don't have to be a PCC or use PMI services. It's completely free. Lots of good practice management resources. Next slide, please. And then, of course, our chapter. Our chapter and our staff and our pediatricians have stepped up to the plate and have spent tireless hours advocating with Governor DeWine's office, Dr. Acton's office, and the Department of Medicaid. And many of you have seen our social media campaign with some of these infographics that you can download, share on your website, share on your social media platforms. Get the message out there of pediatricians' offices are open during COVID-19 for well visits, ill visits, mental health, what practices are doing to stay safe, mask guidelines. And so there is the link, and we would encourage you to please go to that link, use those resources, and share them with your patients in practice. Next slide, please. And as I said, later today, you're going to be receiving some information if you're on the chapter listserv and email list of resources to promote pediatric wellness and preventative care. It's going to contain social media message, a template letter and postcard that you can send to your families, and support for practices and providers on operations, communications, and supporting families. We're also going to be announcing a partnership with Groundwork Ohio and a webinar that'll be coming up later this month. It's really going to be more focused for families and parents, but as always, pediatricians are welcome to sort of review that webinar, and there'll be more information coming soon. Next slide, please. Now I'm going to turn it over to my colleague, Dr. Dritz, to talk about some operations planning.
Great, thanks, Chris. So with the goal of not overlapping too much with what Chris just mentioned, we're going to go over operations and planning ideas, at least for practices, in kind of 4 big categories: how to build confidence, how to build capacity, how to build efficiency, and how to build on effectiveness. So if you can go to the next slide, please. Chris already mentioned, we recognize how important really being proactive in messaging to families are going to be, really getting out the message of how we're there as both a caring part of their family and their family's health, but we're open for care, and really stressing that importance of the cleanliness and the processes and procedures that are now in place in many clinics already and will continue to be sort of improved upon over the next few months. So Chris mentioned a few things that in particular may be unique and creative to get that messaging out, but whether you're using it through email blasts or texting messages, even some practices are putting out video messaging to their families in order to welcome them back and show them the types of new processes that are being implemented to decrease the spread of infection. Those types of proactive messaging mean a lot to families and are going to be part of what helps us build confidence in them coming back. That also means, though, evaluating our own processes about sanitization and sterilization, and really making sure we're following CDC and Ohio Department of Health guidance. Thinking about all of those processes, including what our waiting room looks like and how our families will be in those waiting rooms and our clinic space, as well as thinking about how, for instance, our current screening processes were going, not just for screening for COVID, but meaning screening for all the other things that we normally do day to day in a pediatric clinic. Screening forms that we otherwise would be doing for developmental screening or depression screening. It's useful for us to be thinking ahead about how those processes used to look and how we may need to rethink how they will look so we can minimize the risk of spread, as for many of those processes in clinics used to be done by paper and pens. And again, thinking about how do we minimize contacts unnecessarily and minimize the risk for spread of infection. Next slide, please. it comes to building capacities, this is where I think a lot of creativity will also come into play. So as Chris again also mentioned already, many of us already are doing some unique things in terms of scheduling blocks creatively to help maintain social distancing and cleanliness, including morning well visits versus sick visits more in the afternoon, even considering potential staggered shifts or variation in clinic hours, at least temporarily, as we help, especially with the catch-up care that we anticipate will happen. We also recognize that there are going to be some benefits of still maintaining telehealth appointments for certain types of visits. So really being thoughtful and have clear sort of processes in place in your clinic to determine which types of visits are best going to be met through telehealth versus which ones really are best served by having those families come into the clinic, so we can do our very best job of maintaining the quality of care that we know is so important for our families. As we've mentioned already, really trying to think about how we maximize efficiency, both in terms of what patients are needing as well as what they're coming in for. So thinking proactively about scheduling combination visits for well visits and follow-up appointments simultaneously, or vice versa. As Chris mentioned, if they're coming in for an acute visit and they're due for a well visit, especially now with our current timing and maybe having a little bit more time on our hands with appointments, we have the capacity to really give both the families a bigger bang for their buck for the time that they're spending in our clinic, and for us allowing it to be something that's financially feasible for practices, especially recognizing that those combination well visits and other visits can be billed using a modifier 25 if appropriate. And then, I don't think anyone likes to think about this, but also recognizing that there may be, especially during this catch-up time, a temporary need for delay of vacations or time off while we're at least trying to help families get caught up with the especially preventive care that they've been missing over the past few months. Next slide, please. When it comes to building efficiency, Chris mentioned this already, but those sports physicals are really a prime example, especially for our adolescents, that we want to make the most of every visit, including every well visit, and making sure that every well visit, whether they're coming in knowing that they're going to play a sport or needing a sports physical done, but every well visit should include all the components of a sports physical history and the exam, so that we can try to help keep them healthy in terms of exercise and sports participation over the year, knowing that they can drop that sports form off at any time within the next year, barring any major changes to be signed off for based upon that well visit with you. And it hopefully also reduces the need for families to return unnecessarily to the clinic specifically for that sports physical to be done, or an unnecessary use of retail clinics where we know how important those well visits are for much more than just purely sports participation, like vaccinations and other important screening. Some clinics have also been creative in thinking about how they divide up patient load throughout the clinic day to maybe streamline flow, so that maybe some providers are specifically doing telehealth versus other in-person care. Some may be focusing more on just well visits versus sick visits. Some may be focusing more on just adolescents versus younger care, allowing you to have almost differentiated types of visits or length of time for visits depending on your patient care needs, especially with those adolescent patients. And then, as Chris was mentioning, this is a wonderful opportunity to start to proactively thinking about catching up on care that's necessary for a lot of the chronic health conditions or behavioral health challenges that one may have some benefit to continue to be telehealth, or at the very least as an opportunity to get families back on track in terms of routine monitoring of really important long-term care for chronic illnesses. And as always, with every visit, whether it be in the near future or in the long-term health for all of us, maximizing the processes within our clinic so we can better identify any type of needs that the patient may have, so that we're really trying to minimize those missed opportunities regardless of why they're coming in for, whether we're talking about preventive care and immunizations that they may be due for or overdue for, or those chronic conditions and mental health management. Can you go to the next slide, please? And I'll come back to your point, Chris, about confidentiality and telehealth with adolescents. But the last sort of bucket here I want to talk about is how we can be thinking about as a practice to build effectiveness with the care that we're giving to families. So again, we've all been feeling this, or at least many of us have, with our decrease in clinic load. Really gives us an opportunity to strategize and implement some clinic care improvements. That's where many of us who may or may not already be doing it, but may want to be considering quality improvement types of projects to really help us streamline those processes and enhance quality. And certainly the Ohio AAP chapter has many QI projects available and about to kick off that you may find beneficial for your own practice. This is also, though, a wonderful opportunity for thinking about how our EMR can serve us best and thinking about the population health of our practice and who's due and overdue for things, or anticipating the needs for those families. As well as thinking about the health of our practice as itself, but using some of this downtime to make sure that we have up-to-date clinic disaster and emergency plans, really just as a way to just be efficient with our own time right now. It also can be really helpful to utilize that EMR functionality that we have to really start to understand better who our population is. We may have not had time to really even think about that up until now, but with this extra time on our hands, we may be able to really delve deep into who and how big our population of patients who are struggling with depression or anxiety or chronic conditions, medically complex patients, or even thinking about those patients that may be struggling with some of the social determinants of health, which is where our third point about effectiveness. This may be really a wonderful opportunity for us as practices to consider creating formal coordination efforts with some of our local organizations to best help connect families to the resources that they may need. And many practices may really need even more so now than they have had in the past. And then to reevaluate our EMR templates, processes, the order sets, anything that can help us streamline documentation so that when we really are back to full swing mode, our EMR is not standing in our way in terms of what already sometimes is a struggle in terms of the amount of documentation involved in that streamlining process. Okay, so I think there's a few questions that Dr. Warwick's going to be addressing as we get into the next section. So I'm going to hold off on answering a bunch of questions right now, but I just want to go to the next slide, please. The next two slides we've added, and you'll be getting copies of these slides as well, so you'll have access to them as well. But there was one pre-submitted question around what are the current guidance points for the CDC and the Department of Health around thinking about COVID for pediatric patients in particular. So you'll see here we put some information around the current presentation in epidemiology, specifically thinking about our younger pediatric patients as opposed to the adult patients, and what the current ODH guidelines are for testing, at least in the state of Ohio. The orange arrows really highlighting patients that could potentially be pediatric in nature, so where some of your patients may be falling into. And then the next slide, please, Kristen, is some current guidelines around treatment or thinking about what exposure monitoring should look like for those that have been caring for pediatric patients or any sort of patients at home. So in the interest of time, I'm not going to go over the details of these, but know that you have them available as really just our way of trying to summarize the information that, as of right now, is what the CDC and the Department of Health are trying to guide us with in terms of thinking about COVID and specifically about our pediatric population. So with that, I'm going to send it over to Dr. Warwick so she can talk about supporting families and care and providers.
Great, thanks, Michelle. So I don't pretend to be an expert on this by any means, but I do think that it's important information for us to see and for us to understand as to be good stewards for our families. So you can go ahead and advance to the next slide. Okay, so here's just a list of common concerns that we're going to be addressing for our families and for us to just keep in mind while we're kind of trying to go back into this new normal that we're facing with COVID, and just recognizing that our families are struggling with these things. So employment. So one of the things that Dr. Peltier had mentioned is that we have to be aware that families are going to definitely have been facing these challenges, and that even be prepared for potential changes in insurance. Both for our practices and also to understand and be empathetic for our families. So the things that go along with that are food insecurity, financial issues, stress on the family. So, just being aware of just knowing your resources for those things are going to be really important as we move forward through this time. The other big things are, sick family members. How are, families navigating that? Are they seeing those family members? I know in our office, we're getting a lot of questions as far as guidance, and, who can I see? And, when's an okay time to visit grandma? And I think those are really challenging things to navigate right now because, there is a big question mark and there's not always a one size fits all answer. Other big things are, masking, which is a new normal for us, and then, addressing physical distancing and social distancing for families. Go ahead to next slide, please. So we wanted to just make sure that, that you guys are doing this in your practices and really incorporating this into your kind of day-to-day workload. Some things that we had suggested as far as, other things that other practices have done are, using any kind of like EMR scripting or some type of smart phrase to kind of help, put these in the forefront of your mind to ask about. So, how are you doing? That's something that we kind of take for granted. But I think now with this new normal of just even being more so about, really having that as our the front of our mind with asking for families, asking if, family members are working. And also if, if not, are they filing for unemployment? Are there other things that they're doing to help themselves in this time? Oh, hang on, Maddie. The other thing would be is, our families, that are not, have children that are school age, are they able to access, school lunch programs or other things that can help them with different, food insecurity issues or transportation issues? The other big thing, and this is a hard question to ask, is, do they have enough money for food, rent, and bills? And I think I always second guess my ability to ask those unless I really truly have resources to give those families, because that can certainly be a hard question to ask when you feel like you don't have, a follow-up to that. So, having those resources, or a way to refer those families can be really helpful. Also asking who are they seeing, that really does help with, when we're thinking about differential diagnosis for illness. Our families understanding what social distancing, can we be good stewards to show them what those are? And then also sharing your own experience. I think it's really helpful, and I'll kind of go into this in a little bit, is that we are really the models for our families and for our patients, and sharing experience that you've had with your family or other family members, and what they've done to really be helpful during this time. So, okay, you can go into the next slide. So these are just general guidelines. Again, I don't proclaim to be an expert on these, but these are just kind of good common sense that I think are good for us to really understand. And I'll show you some resources at the end that can be helpful about how to share with your families, and also for you to read more into it if you do have interest. But first and foremost, to share with families is it's important to take care of yourself, not only just from a, an illness standpoint, but also just kind of maintaining normal schedules, getting regular exercise, having good sleep hygiene. Those are things that I think when, things get, off kilter, we certainly forget about. And I think having, new demands on families with, trying to balance working from home or not working, and also with kids at home and not in school, can definitely make for challenging times there. But it's also to make time for fun and relaxation, even in different ways that we hadn't thought about before. It's You're not going to the zoo, but certainly there are online resources where you can go and see animals at the zoo. And I know some families and friends that I've had have done those things and have just kind of had different experiences, but also fruitful experiences for their own children. The other big thing is to point out is that, times like these can lead to some unhealthy coping behaviors. So really trying to kind of gauge that for families or people that you feel like may be at risk, just kind of checking in with that and seeing if there's anything that we could do to support them further. The third bullet, and this is the most important thing I think really, is to connect with others. And it may not be in the same ways that you're used to, but certainly there are plenty of new ways, whether it's online or, by phone. Just remembering to connect with other people can really be helpful to really help your own mental health and also help with families as well. And then, maintaining preventative health care. Chris touched on this, and Michelle as well, is that stay in contact with your pediatrician, for your children if they're not feeling well. That's really important, not being scared to do so, because really we can be of help. And whether that's via telehealth or in the office, we are well equipped to do so. And then lastly, just taking a break from watching or listening to the news and social media. I think a lot of families feel consumed by that. And I think it really can impact mental health and also have, secondary anxiety for kids when they're just hearing these things in the background. I know for my own kids, we don't bring it up a lot in our house, but I think even hearing things from our babysitter, they ask a lot about it. And I think just kind of knowing the proper dosing of that can be really helpful for families. So next slide, please. These are just considerations, and I touched on a couple of these, is just really having in place these plans and resources for families. I know in our practice we have access to a parent coach that can do some counseling, and I know every practice does have kind of their chosen group of behavioral counseling resources. And I think just having those at the ready for families, because in times like this, these will be really essential to kind of help support families through this. The other thing is, other community agencies like food banks or, things like that can be really important for families that are going through tough financial times. And then secondarily, insurance changes. I know we had touched on this before about willingness to increase our Medicaid patients as they lose coverage, because hopefully as things will pass and we get back to more normalcy, is that those families that you help through this difficult time will still remember that and hopefully stick with you for the long haul. Go ahead, next slide then. Okay, so these are some resources, and I hadn't been much on, any type of meditation beforehand, but I know, some of this had come about, and I think I had even dabbled a little bit into looking into this, but it really can be helpful. And even if it's not going through a formal program of meditation, but at least taking some time each day, to kind of stop, think, reflect on what's going on can really be helpful, not only for us as providers, but also for sharing this with our families. And there are plenty of free resources out there, and I just put a couple on this website here. So, just to kind of, if you have some time to look through and Google a couple of these, it can you can kind of get a good gauge on what it looks like. But the Headspace and the Stop, Think, Breathe, and Think are more kind of prescriptive ways of meditating, because they're kind of like a how-to, kind of cartoon-like, and how they're put together. The Aura and Calm are more of kind of your Zen, focused type ones for meditation. But all of these programs have different, you can go through like a true program of meditation, or you can just tune in for a 2-minute or less version of it. Or you can even go to YouTube, and several of them have different dedicated channels that you can use for those. But what I liked about the Stop, Breathe, and Think was there's a kids version for that as well, which I think would be a good resource for families. So go ahead to the next slide then. Okay, and this is just kind of a brief snapshot. I know we've talked about using healthy doses of social media, because it can be helpful for some people as like a way to kind of unite with other providers, or for families to unite with friends and family members, to really kind of empathize with them, and also with gaining support. Here's just a couple of posts from some of our pediatricians around the state that really I thought were kind of hit the nail on the head. So The first on the farthest left-hand side was Dr. Adams kind of reminding us to do those good self-care things and also kind of to stay healthy. So the one in the middle is Dr. Nicole Baldwin, and she's a local pediatrician in the Cincinnati area, talking more about kind of the mental illness and kind of things that really families are struggling with. So, saying I'm not giving up and really trying to support her patients and families through that. And so what an excellent example is what Chris pointed out earlier of if you don't have a social media account, that they would be really helpful, for families and for practices to really put that out there. It's a good communication tool. And then the last one is actually Dr. Baldwin kind of demonstrating that she started her meditation journey and did some headspace. So again, a kind of a good, good model for her family. So next slide. Okay, and so here are some other resources that I put up here. So, so the first one is AAP, thehealthychildren.org. There's some really good information there that are downloadable and printable for patients and families about, COVID resources, illness resources, and other just overall good healthy children resources. So I encourage you to go out there and look at that. It's really good digestible information that is just at the ready for families. The second bullet point that Chris kind of actually had put up a couple posts about was through the Ohio AAP, their COVID resource tab is really beneficial and really readily accessible from their main homepage. And you could print any of those infographics. I know we have some of those posted in our office. They're just helpful for families and they're really easy to read. So those can be helpful as well. The third bullet point was from the CDC about some other good healthy living techniques and also just overall good health guidance during this pandemic. I thought that was helpful from both a provider standpoint and a patient standpoint. And then lastly here, this Northwestern University, it's called the IntelliCare Hub. And what it is, it's a collection of resources for people to use, both providers and patients, for different things like anxiety, depression, mental illness, different obsessive behaviors. And it's just a great collection and a really outstanding resource there. Next slide. Some other resources that are listed here. So one is a podcast that I actually got the opportunity to participate in about emotional health while sheltering in place. And I think it's a good resources for families. It involves two different behavioral health specialists that are really well versed in this type of material. The second is about talking to teens and tweens about coronavirus and managing anxiety, which is a huge portion of our patient populations. And then lastly is just another website material about the reassuring children about the coronavirus done by Chris Bowling, who's a pediatrician in Northern Kentucky. Go ahead, next slide. Okay, so then this last piece is about provider wellness, and some of this is going to echo a lot about what we talked about for supporting our families, but still good information to review. So go ahead and do next slide. So the scope of the problem, so really this is an unprecedented time, creating unprecedented challenges with this COVID pandemic that really impacts our physician well-being and also stress levels of everyone from staff to families to even ourselves. And we're really particularly affected as being frontline healthcare professionals. Really the people that have suffered with COVID disease and secondary effects of depression, anxiety are physicians. And I think one example of this that you may have heard on the news was the emergency room physician, Dr. Laura Breen, who committed suicide last month after caring for COVID patients in New York City. Next page. So again, these are the provider emotions that people go through. And, I think everyone can identify with a little bit of this. So first and foremost, guilt, second, fear, and then third, anxiety, along with a slew of other emotions. And I think the reason why I put Dr. Acton on here is I know she likes to talk about the Kubler-Ross grief cycle about, going through denial to anger to bargaining, depression, and acceptance. And whether it's about masking or about kind of changes in your new normal, I think they're just important to keep in mind and for us to realize that not only, are our patients going through this, but we're going through this to a certain extent as well. Next slide. So ways to cope with this, and this is echoing some of the things that I had shared about for patients and families, but not only are we taking care of ourselves, but we're also taking care of our families and our coworkers. So just being mindful about that and just realizing, that, despite, what we're modeling for patients and families, but really just kind of taking our own advice sometimes can be really beneficial. And the third bullet point, talking about connecting with others, it's important, as we're trying to kind of figuring out how to navigate this with our, practices, is that, not only are we connecting with our, medical, colleagues, but we're also connecting with those non-medical too, to really ground us and realize, not only are we going through this from a provider standpoint, but we're going through this as people as well. And it's important to remember that. Go ahead, next slide. So this is the biggest message that I can really share with people, is that we are truly modeling these coping behaviors for our patients and families. And so just being mindful of that, whether we're talking about what we're seeing on social media or what we're seeing in our offices. But I think really when we look back on this time, is we want to remember that we were good and healthy models for these, for our patients and families. Next slide. So this is a kind of our, the last few slides here, resources and hotlines for families and for patients, so, and for providers. So disaster distress helpline, and then the Ohio crisis text line. These are more resources for mental health. The third one is Ohio Department of Mental Health and Addiction Services helpline. So kind of going back to those, non-healthy coping mechanisms and how those tend to kind of rear their ugly heads during this time. And then lastly, about this resource, the Ohio Department of Mental Health and Addiction Services, they have a whole website about resources they have during this specific coronavirus time. Next slide. Okay, so I'm going to turn it back to Kristen, where she can kind of field some questions. I know there were a few that came through the chat box, and we really appreciate your time. I think we really are hoping to kind of share with you what we're dealing with during this time, and hope that we can commiserate in that way. But I think also too that, from this has come so much good about, being able to share resources with, other providers across the state. And I hope that not only that's part of the new normal that will continue moving forward.
And thank you again to all of our panelists. I know we've had a few comments and questions in the chat box. Thank you, Dr. Dritz, for mentioning the confidentiality with adolescents and ways to do that. This is kind of your, in the last few minutes, opportunity if you have additional questions to chat those in, or if any of the panelists had additional items that you wanted to mention now that we're kind of at the end of the webinar.
I will just remind everybody to be on the lookout today from the email blast from the chapter that's going to have the toolkit that I mentioned. Again, a lot of good resources. Please come to our website to get more resources. And just, sort of echoing what Denise said, just everybody, we appreciate what everybody's doing for your practices and for the children in the state of Ohio, and just take care of yourselves and keep fighting the good fight. And thanks for all that everybody's doing.
Yes, and I'd love to echo that too. And Olivia, if you could move us to the next slide. Again, this is the chapter COVID-19 resource page. So feel free to go to the Ohio chapter website, and you can find all of these resources and more. And next slide, please. Also, just mentioning, as I said at the beginning, this is a 3-part series that we're wanting to do. We are planning to do the third and final webinar on June 15th, lunchtime. The topic will be preparing for back to school and flu season, but also we would love to hear from you if you have additional items or topics that you would like us to cover or help with. Please don't hesitate to send me an email and let me know, and we can include those in our third webinar. And then next slide, just a final reminder to to follow us on all of our social media outlets. All right, and thank you again, everyone. Like I said, we will follow up with the recording, slides, and the chat transcript as well. Everyone have a great day.
Take care, everybody. Thanks for joining us.